Good afternoon, everybody. It is another Friday. Senator Liz Bolden here, just checking in to share a little bit about my week and what my office has been working on. It has been another really busy week. We had 11 bills heard in committee this week, so I'm going to run through those. I'm looking at my whiteboard in front of me here to help jog my memory, and then we passed a couple of bills off the floor as well. So lots of really good work happening here in St. Paul. So wanted to just share with you what I have been up to. On Monday, I had a bill heard in the Jobs Committee around funding for a healthcare simulation center, which is really exciting. It would be a collaborative space to be used, multidisciplinary, but centered around healthcare, which really would help with our workforce issues and help to both upskill and train new healthcare staff, and including nurses. So really excited about that bill. I also had a bill heard in the Commerce Committee around Medigap policies. So these are insurance policies that typically older Minnesotans buy to fill in the gaps of what Medicare does not cover. And while Medicare is a federal policy, federal issue, these Medigap policies are regulated at the state level. And while we have become accustomed to pre-existing conditions not being an issue anymore with the Affordable Care Act, most policies can't be withheld because of pre-existing conditions. With these Medigap policies, that is still allowed. And so working to close that loophole and not allow pre-existing conditions be a reason for people to be denied for this coverage that is needed. On Tuesday, had a couple of bills around mental health. One bill that would increase the reimbursement rates for mental health services. Really important to be sure that more people can have access to the care that they need. Another one around mental health, streamlining the requirements, sort of getting rid of unnecessary red tape and requirements for folks delivering mental health care. So both of those really aimed at increasing access for mental health care for Minnesotans, which we know is greatly needed. I also had a bill up to provide funding for the Boys and Girls Club, a wonderful organization in our community doing really great work. So just to ensure that they have the resources they need to continue that work. And then also had a bill up in education finance around school nurses. 2/3 of the schools in our state do not have a nurse in that school. And we know the value that nurses bring, and especially for students. And so making sure that we are providing funding and that we are having nurses in schools to help our students be as healthy as they can be in schools. Yesterday, I had 2 bills up in capital investment. Because we know we did not get a bonding bill passed a week or 2 ago. We now are looking to put together a cash bill for some infrastructure and capital investment projects. And so 2 of those projects that I'm working on are Graham Park, which is an exhibition center, which would be a regional asset for our community. And then also the simulation center that I mentioned before, would be some funding, hopefully, for that as well. And then today, I have had 3 bills up. The first is charity care, which I've spoken out before, which is around making sure that hospitals are providing information to people around insurance coverage if they're eligible for it, and charity care if they are eligible for assistance with their medical bills. They should have that information. And so this was just our next stop. We were in judiciary today, and so our next stop in the process, and it went really well. Really powerful testimony about what medical debt means for Minnesotans. Also had the bill around adult changing facilities, which I have spoken about that as well. Really powerful testimony. We were in the state and local government committee today, again, just the next stop in the process for that. And so I'm just really grateful for the folks who came to testify and to speak about what a difference that would make in their lives. Really important for many Minnesotans and largely our friends and neighbors with disabilities. And then lastly, I'm just on my way to the Health and Human Services Committee just right after this, and I'll be presenting a bill on homelessness and Olmsted County homelessness relief. So some funding going to the county to assist in providing services to those experiencing homelessness. 2 other bills that we passed off the Senate floor this week. One was Senator Westland's bill, the Uniform Electronic Wills Act, has to do with the electronic process for wills. And then Senator Nicole Mitchell had a bill to update the Veterans Restorative Justice Act. And so both of those passed off the floor this week. So lots of good work happening here. Today is actually the second deadline day. And so we're getting closer to third deadline. And really just what that means is, for bills to stay alive, they have to meet these certain deadlines. So we will be in the process now this next couple of weeks. Committees will be putting together their omnibus bills, those package bills that will be passing largely in April. And so putting the budget together, and budget targets came out this week. I posted about that. So lots happening here, lots of really good work. And so if you have questions about anything that I'm working on or things that are happening here in the Senate, feel free to reach out. Want to stay connected, and have a great weekend.